The emergency quarantine center at the EX-ORCA supermarket here in Yaoundé is set to welcome patients while the site in the military stadium has been suspended and the premises deserted. Mayors in Cameroon received mandates from the Ministry of Decentralization and Local Development to be fully immersed in the ongoing fight against the coronavirus, whose infection rate is reaching alarming proportions. It's 30 years today when Cameroon stunned the football world by becoming the first African country to qualify for the quarterfinals of the World Cup after beating defending champions Argentina in their tournament opener. Those are our top stories. Hello, welcome to the program. I am Ben Meno Pufong, and this is the 7:30 news. But first, this message from the President to you.
Each of us must comply with the measures that have been taken.
Welcome once again. The two new makeshift centers set up in Yaoundé to cater for COVID-19 patients are yet to be fully operational. If the premises of the EX-ORCA supermarket with the capacity of 281 beds is already done and dusted, work, on the other hand, has been suspended at the Yaoundé Military Stadium Emergency Quarantine Center, and where it has been suspended and the site deserted. Ewane Epole was out there at the two centers and is here with this eyewitness recount.
This specialized center for the care of COVID-19 patients at the ORCA premises in Vongbi, Yaoundé, has a capacity of 281 beds. As the Yaoundé Central Hospital is almost getting overwhelmed, the Annex 2 of the health structure with an up-to-date medical equipment is being prepared to take the relay. The 281 beds, bathrooms and toilets have been set up for potential patients. Most of the quarantine facilities have been put in place. They include a reception room, reanimation space, administrative section, sanitation and wash services. A functional communication system has been made available, as well as ventilated examination rooms, nursing stations and catering facilities. According to one of the health officials, cartons of drugs for the treatment of COVID-19 patients have been stored in the center's pharmacy as they are preparing to receive the first group of patients. The over 34 medical staff posted at the center have taken service, but a modern oxygen production unit badly needed in this special hospital is yet to be installed. Meanwhile, at the emergency quarantine center of the Yaoundé Military Stadium, a number of beds, tables and chairs have been placed in the different wards of the makeshift hospital. For now, installation work here has been suspended and the quarantine center deserted.
A water container of about 1,000 cubic meters capacity and other items intended to limit the spread of the coronavirus have been donated to the University of Douala. These items, produced by the students and the lecturers of the Faculty of Science of the Institution of Higher Learning, have been funded by the Member of Parliament for Vuri East, Honorable Elise Pokosindumbe. From Douala, Alphonse Abongwa reports. We should be going over now to the center region to talk about the public health delegate from all the 10 regions of the country who are being trained in Yaoundé on the prevention and management of the COVID-19 pandemic. The training that has been co-organized by the World Health Organization and the Public Health Ministry of Cameroon is intended to reinforce the ongoing strategy to stop the propagation of the virus in the country. As Ghislaine Koa reports from CRTV Center, the capacity building workshop will run for 5 days.
Workshop launched in Yaoundé this Monday brings together public health delegates and clinicians from the 10 regions of the country to drill them on how to reinforce the staff of COVID-19 care units and their workings.
This training is really to train people who have come from those regions in order for them to go back and train colleagues in the district hospital, district management, again in those two areas of case management and infection prevention and control. With the steady rise of COVID-19 cases in the country, the training program is just timely.
This training is very important because we will have all the personnel of our health facility at the level of the health district who will be well trained to better manage patients.
This capacity building workshop is intended to consolidate the centers created across the national territory. That is why the participants are expected to acquire the necessary skills to enable them better drill their collaborators in the regions on the coronavirus pandemic.
Let's now talk about back to school. 1 week into the third term of the 2019-2020 school year, teachers say the respect of the COVID-19 preventive measures has improved. School authorities, for their part, acknowledge with satisfaction that pupils and students are gradually adhering to the new rules with the wearing of face masks and regular hand washing. They have made it a daily habit. Joy Starter visited some schools to assess the effective respect of barrier measures and brought back this report.
As the days go by, schools in the nation's capital step up strategies to fight COVID-19. The students of Government Bilingual High School, Corbisom, meet a new phase this Monday morning.
This week, we've started with the disinfection of legs. If you have noticed there at the gates, when teachers and students are entering, they wash their hands, their temperature is taken, and equally disinfect legs.
Week 2 kickstarts with more equipped learners and teachers to fight the disease in the school milieu, even though teachers on their part keep playing the reminder role.
I am going to Bafia tomorrow. Excellent.
The students are getting used to the new barriers, but for the fact that they find it a little bit difficult with their masks on. Some of them complain that it is like suffocating them. We have been strictly following the measures. We are telling them the use, the necessity to follow all the measures.
At the primary level, school authorities go as far as making sure each pupil wears a face mask, has his snack, water and hand sanitizer before gaining access to class.
You have to wear your mask during the day. Is it okay? Yes. Okay.
At this pace, teachers believe the pupils and students in some time to come will completely be acquainted to these barrier measures to successfully wrap up the 2019-2020 school year, far from the coronavirus threat.
Cameroonian parliamentarians have concluded a 4-day seminar in Yaoundé on the understanding of the ramifications of parliamentary activities. Organized by the Pan-African Institute for Democracy, the workshop was intended to make the MPs, especially the freshly elected ones, get acquainted with the environment they were stepping into and the role they are expected to play as local development, as local developers within an era of decentralization. We have details with Kilian Dandifon.
For 4 days of capacity building on parliamentary business, attendees admit that the training was timely on the eve of their first session in the Cameroonian bicameral parliament.
I have learned a lot. The parliamentarian diplomacy, how the senator could be involved clearly on the field, local development, considering the new general code of decentralization which have been voted. It is very important that the parliamentarian knows exactly how to improve how to put in his own contribution.
Schooled on the ramifications of the functioning of Parliament, there was emphasis on the special context of their role in diplomatic affairs.
The executive, for example, has the exclusive role of ratifying treaties, but the treaties that falls under the areas of law must be approved by the parliaments before being ratified.
Parliamentarians carry out elaboration and codification of laws, normative action as well as development. Though not in the mandatory sense, they are also involved in diplomacy through presence, participation, and image protection in line with the general orientation of the country's diplomacy.
As members of Parliament prepare for the June session, ordinary session of Parliament, the populations of the West region say they are looking forward to seeing COVID-19 related issues on the table of discussion. Others are simply saying that the members of Parliament should ensure that development projects are executed in spite of the prevailing public health crisis. Kemp Vinembo sampled those opinions for the 7:30 News.
A prelude to the June session of the National Assembly, the population of the West region say they will love to see the members of Parliament work in unison to make an overall assessment of government's response strategy to the coronavirus pandemic and to equally make some resounding recommendations if need be. And as Cameroon and the world continue to struggle to find a solution to this disturbing global health crisis, some of the inhabitants wonder whether Cameroon is on track to implement the universal healthcare coverage, a question they will want the MPs to table before Parliament. The problem of water scarcity and frequent power outages should also be on the agenda. Some people say they complain that the regular washing of hands during this pandemic cannot be fully respected if taps remain dry. Getting up-to-date information about COVID-19 will be a far-fetched dream if the problem of frequent power outages is not resolved. Some have stressed the need for the government to make sure that all developmental projects in the region and Cameroon in general be executed in due time, even amidst the COVID-19 pandemic. The 2020 June session of the National Assembly is expected to begin this Wednesday, June the 10th, and the people of the Western region are looking up to their representatives to present the problems raised before Parliament and hope their voices will be heard.
Inhabitants of the Douala 1 municipality have been heaving a sigh of relief with the launching of rehabilitation works on stretches of road along the Rond-Point Daido and Aqua neighborhoods. According to the city mayor of Douala, Roger Mbasindine, who is leading the initiative, the projects are intended to ease circulation in the city, especially within these thickly populated neighborhoods. As Cynthia Etim reports from Douala, the works are being carried out by Chinese contractors.
This is Place Sandaga, a section of the roads around the Rond-Point Daido in the Douala 1 Council. Rehabilitation work here is in full course. Road users have begun heaving a sigh of relief for the work done here, as it will ease circulation in the days ahead and their daily activity along the stretch of road will blossom again.
This road has been deteriorated for long. And so what we see they are doing now, and if I look at the depth, the mixture of what they're trying to put in place, I know that they're doing a good job.
The rehabilitation work carried out by the Douala City Council in collaboration with partners, according to a communique signed by the city mayor, Roger Mbasandine, will cover the Place Sandaga, Reunification Boulevard, Troal Boutique, Boulevard de la Jeunesse and Boulevard de la Liberté stretch of roads.
The advantage to us around here is that there will be easy accessibility, because like in the past, it would take about 10 minutes for a vehicle to move here because the roads were bad. After this work, I think there will be easy accessibility.
The rehabilitation work that started on June 5 will run till June 30, 2020, and the road sections along the Rond-Point Daido in the economic capital will regain its beauty.
The doors of the Mario Polyclinic in Douala that were sealed last May 14 by the senior divisional officer for the Vuri on the instructions of the Minister of Public Health have been reopened. The structure was shut down for illegally handling COVID-19 cases. Let's now join Alphonse Bongwa in Douala with details.
Less than 1 month after Public Health Minister Dr. Manauda Malashi ordered the closure of Mario Polyclinic in Douala, he says the doors should be reopened. What has transpired between government and the hospital officials?
The first thing we told the minister is that we did nothing but our job, which is to treat patients. Perhaps we went wrong by violating the Prime Minister's decision on specialized treatment centers in the country, but we took the choice of treating the sick. Certainly we had issues that did not go well in terms of our bills, but we do everything here in transparency.
The minister's communique ordering the reopening of the health structure further says there is ongoing dialogue between officials of the National Order of Medical Doctors and government, which will eventually lead to another government decision to bring in some private health facilities in the national strategy to address COVID-19 cases in the country. For now, no one can clearly tell the content of the discussions, but Mario Polyclinic officials say they are ready to join government in the battle against the pandemic. Since Friday, June 8, that the clinic doors were opened, work has resumed on a rather slow pace. Cameroon currently numbers over 7,000 cases of COVID-19, and government feels relying solely on public hospitals is certainly no best option.
Let's go back to the 2020 finance law that has just been modified and whose major innovation is the creation of a national solidarity fund for the fight against the coronavirus. This follows the presidential ordinance of June 20, modifying certain provisions of the 2020 finance law, which has seen the state budget dropped by close to over 5,000 billion CFA francs. Clarissa Ray Takang now puts this call for solidarity in perspective.
The creation of the National Solidarity Fund comes at a time when efforts aimed at containing COVID-19 nationwide will require more financial resources to fully implement effective preventive and control mechanisms. Finance officials explained that the 180 billion CFA francs will be secured from diverse sources.
The revenues to impact on the fund will be donation coming from individuals, legal or moral persons, or other funds coming from our international partners. We also have donation of goods coming from other partners that will go into the fund, and then thirdly, funds coming from the general budget.
The funds target specific areas.
It also tackled action related to creating safety systems to help take care of children, the street children, and also creating a system of distance education. They will also have to finance certain companies working in the sector that are highly impacted by the coronavirus to make sure that they stay into business. The government will also pump in money to research and development, especially in pharmaceutical industries. They will pump in money to certain agricultural sectors like by providing agricultural inputs.
According to authorities from the Ministry of Finance, solidarity should prevail over any other concerns not related to checking the spread of the coronavirus. A drop in the budget, they added, implies that only priority sectors will receive government intervention.
5 health units in the Tuboro subdivision have received COVID-19 kits from the Meganga office of the UNHCR. Speaking at the ceremony, the divisional officer of the locality emphasized the need for vigilance to be stepped up in the Transborder subdivision. A similar exercise took place in Garwa Bulai, still organized by the UNHCR. We have details with Nueya Ben Mudika from CRTV Adamawa.
Occupying a strategic location on the Douala-Ngaoundéré-N'Djamena corridor, teaming exchanges between Chad and the Central African Republic make Tuboro even more vulnerable to the COVID-19 pandemic. According to the local UNHCR official, Guy René Dagbo, this first stock of kits coming after sensitization and training activities is to reinforce previous donations by the government and other partners.
We are disinfecting all the schools. We are trying to give them masks and kit of washing hands.
Like the MP Buba Musa, Dio Nujigumen Elias expressed gratitude to the UNHCR, whom they termed an all-time partner. As part of ongoing preventive measures, the UNHCR announced that crowd pulling and risky activities have been suspended or reviewed until further notice. The Menganga office of the UNHCR decided to reinforce the capacities of the frontier post, the Gado Bajere Integrated Health Center, and the Garwabulai District Hospital with anti-COVID diagnosis and management kits like hand-washing buckets with tabs, hydroalcoholic gels, liquid soap. Like the mayor, the DO for Garwabulai, DN Jam Lawrence, lauded this other gesture of the UNHCR, especially as the COVID-19 infection rate in the transit and frontier town has risen from 5 cases to 45 in 20 days.
I want to call on the population to understand that the measures that the government took to make life easy for the population does not mean that the COVID-19 pandemic has come to an end.
According to the head of the UN Refugee Agency Office for Menganga, Josephine Dayizigiye, it is their pleasure to continue helping the government in the care of the refugees and the host populations at all times, and especially in this context.
We now take you over to the Public Health Emergency Operations Center, from where our reporter, Baldwin Sama, has an update on the COVID-19 situation in Cameroon today. Hello, Baldwin. You say the number of COVID-19 patients keep rising in the country. Is that correct?
Good evening to you, Ben Menopufong, and welcome to the Public Health Emergency Operations Center. Just to confirm what you said a while ago, the number of Cameroonians infected with COVID-19 keeps increasing on a daily basis, and this Monday we have 252 confirmed cases of Cameroonians who have been infected with COVID-19. And equally this Monday, we have 46 Cameroonians who have recovered from the virus, and 2 Cameroonians died of COVID-19 this Monday, with measures put in place by the Ministry of Public Health to save as many lives as possible. Now, tonight with our guest, Dr. Eric Tanzi, who is a public health expert in the Ministry of Public Health, we wish to look at active cases, talking about the number of infected persons in the country. Good evening, Doctor.
Yeah, good evening, Baldwin.
Let's say the example for tonight, where we say we have 252 Cameroonians who have been infected. When we talk about an active case in terms of infections, what is an active case, and how do we get to the number of infected or number of active cases daily?
Yeah, Baldwin, you know, once we are in an epidemic like what we're having now, it's but normal for us to have these cases or this number increasing per day. But before we get to that, our concern much is when we start losing souls. Once every soul is lost, is a problem to us. And that is why we try as much as possible to save, just like you rightly said, to save life. But coming to active cases, you know, when you take out the number of recoveries and the number of deaths, and then the cases that are positive, that are living within the context, that are the cases, or those are the cases we call active cases.
And doctor, during screening, the samples are collected from individuals who go and have themselves screened. What's the difference between samples collected and the different cases?
Yeah, you know, it's not everybody that is being sampled that is confirmed positive or confirmed negative. So in a pool of samples that have been collected for a day, there is what we call diagnosis. Testing needs to be done. And it is only after testing that we can now conclude either you are negative or positive, which therefore means that in a pool of the samples that have been collected, we are able to have either 0 positive case, or we are going to have a certain number of positive cases out of the total number that was sampled, and a number of cases out of the number that were negative. But then we can equally arrive at a situation where all samples that were equally positive or negative. So all samples that have been collected in a day will equally give you the total number of samples that have been sampled for that day.
Thank you so much, Doug, for being a guest on the 7:30 newscast. Ben Menopufong, during the traditional press briefing here at this Public Health Emergency Operations Center, public health experts use the opportunity to remind Cameroonians not to panic if you get to discover any signs or symptoms as far as COVID-19 is concerned. On the contrary, you have to have yourself screened and be sure. They cited the example of the head of state speech to the nation on last May 19, calling on Cameroonians to be able to live up to expectations. And they equally talked about the collaboration that's existing between the Ministry of Public Health and other ministries, such as the Ministries of Higher, Secondary and Basic Education, and equally the Ministry of Communication and External Relations, as far as the ongoing follow-up of different cases, the spread of COVID-19 in the country is concerned, talking about an increase in the number of screening centers we have in the country to permit many Cameroonians to get to have themselves screened and know their status. They equally talked about an increase in the number of treatment centers in the country to be able to save as many lives as possible. The take-home message from here tonight is we have 252 Cameroonians who are infected with COVID-19 this Monday, 46 recoveries, and 2 Cameroonians died of COVID-19. Back to you, Ben Menopufong.
Thank you very much, Baldwin Sama, for those updates from the Public Health Emergency Center out there at Mesa here in Yaoundé. And we continue in the same wavelength to say the fight against the coronavirus nationwide has seen municipal authorities actively involved in managing the pandemic and its consequences, such as burying those who die from the disease. These activities are done under the supervision of the Ministry of Decentralization and Local Development based on specific requirements. Alice May reports on the special missions devolving of municipal authorities.
To assist the government to fight against the COVID-19 pandemic at the local levels, the Minister of Decentralization and Local Development, George Elanga Obam, has provided sanitary kits to the mayors of the various councils to share to the population.
What we did was to make them be one of the actors in terms of public awareness, putting in place all the prevention and protection kits. They are also involved on the aspects of accompanying hospitals and also to be part of the process in the burial of corpses due to COVID-19.
He has also authorized the mayors to provide all necessary assistance to the patients at their local levels while expecting financial support from the government.
The different councils are managing with the money they have in their councils, and the minister has told them to send report on all expenses at their level to the ministry. He is doing everything possible for finances to be provided to the mayors by the end of this month.
They have also been charged to implement strict respect of hygiene and barrier measures at their levels to assist the government in the fight against the COVID-19 pandemic in the country.
The wearing of face masks in public places will be mandatory until further notice.
You're watching the 7:30 news on the Cameroon Radio Television, the CRTV. We are beaming live from Yaoundé. Now on to this obituary. The death has been announced of the former president of the Cameroon Bar Council, Barrister Sama Francis Asanga. The 62-year-old lawyer died this morning in a Yaoundé clinic. He was president of the Bar Council for 3 years, spanning from 2012 to 2015. His mortal remains were immediately laid to rest, as we hear in this report with Sidoni Jobmandi.
The prominent lawyer, Barrister Sama Francis Asanga, former president of the Cameroon Bar Association, died suddenly this morning in the early hours.
We were taken by surprise. We didn't expect such information to come to us and in such a manner. And of course, what is very, very sad about it is that based on the prescriptions of government, he has to be buried suddenly. And we lawyers have traditions, you know, the way we bury our colleagues.
The 62-year-old Bâtonnier Emeritus was among the key members of the Social Democratic Front and the party's lead counsel on several occasions, notably during electoral affairs. Barrister Sama Francis Asanga, who served as the president of the bar from 2012 to 2015, was among those who fought for the amelioration of lawyer status in Cameroon.
It's a great loss to the Cameroon Bar Association. It's a loss to lawyers, judicial family in Cameroon, because he was one of the foremost leaders in the fighting for the rule of law, human rights, electoral disputes. He was a lawyer who used to be president of the Cameroon Bar for about 5 years. He had a lot of projects for the bar.
Due to the health crisis which prevailed in the country, last respect was given by lawyers to the late Bâtonnier at the hospital where he passed away, in Yaoundé. Meanwhile, authorities of the Cameroon Bar Association reassure the judicial corps of a special burial arrangement which will be made in honor of the late Bâtonnier after the deadly pandemic.
Let's now talk sports. They created history in the world of football in 1990 as the first African country to reach the quarter-final stage of the Football World Cup. Cameroon's indomitable Lions, in their second ever World Cup participation in Italy in 1990, took the world by surprise in their tournament opener against the then defending champions Argentina with an emphatic 1-0 victory. That was on June 8, 1990. It's exactly 30 years today, and the memories, especially the stunning match against Argentina, remain fresh in the minds of Cameroonians and many are football pundits. Bolden Sama takes us down memory lane 30 years ago.
History was created, and history will remember June 8, 1990, when Cameroon's indomitable Lions, little known at the time, came calling at their second ever FIFA World Cup participation. And their opponent was Argentina, defending World Cup champions. Argentina, led by super-class striker Diego Armando Maradona, whose pre-match warm-up session left many shivering. Led by Captain Stephen Tator, Cameroon came close to opening scores with 2 failed attempts from Francois Omambiik. Minutes died down and there was tension in the air with Kana Biik red carded after a foul on Kaneja. Playing 10 against 11, the Lions' moments of reckoning came after this free kick that saw Francois Omambiik jump highest and with a powerful header sent goalkeeper Pompidou to the back of his net.
There was no time to jubilate. Thousands of supporters who were shouting, "Cameroon, Cameroon."
After 90 minutes of play, Cameroon had tamed Argentina 1-0, and the joy was total among the different football fans present, with President Paul Biya congratulated by his peers. That victory set the pace for a beautiful World Cup participation that unfortunately ended at the quarterfinals against England.
And the memories still live on. The Association of Former Players of Cameroon's national football team, the Indomitable Lions, has made a donation of food items to the Fondation Fact orphanage in Essos here in Yaoundé. The goodwill gesture was spearheaded by the association's president, Bertin Ebuele, who was accompanied by some players of the Italy 1990 squad that you just watched moments ago. Details with Romeo Kenya.
Former Indomitable Lions players present in an orphanage in Yaoundé. They came this Monday with foodstuffs for youngsters residing here. The gesture, spearheaded by Ex-Footballers Association President Bertin Ebuele, was equally attended by Roving Ambassador Albert Roger Mila.
30 years ago, we did something exceptional, and we have to commemorate the day. We had a few things to do regarding to the event. We came today in this orphanage to give back what we got from the Cameroonians from Cameroon, to see, to show how we care about the country, how we care about the youth, how we care about everybody. I think they need it, and we are very glad to have done it.
The orphanhood dubbed Fondation Fact was created in 1981 and has been based here in Essos since 1992. It is home to children of diverse backgrounds. The occasion was also a moment for the ex-players to pay tribute to some of their deceased teammates, at the same time sharing the good memories of the 1990 FIFA World Cup hosted by Italy.
Romeo Kenya there, putting a cap at this edition of the 7:30 news. Let's take rendezvous for tomorrow, 7:30. Thanks for watching.
In this connection, we should avoid stigmatizing.
CRTV News, ici, toute l'info.